Good afternoon. We're at EHA 2018. It is Saturday, and I'm Blake Morrison with World Myeloma Forum here with Francesca Gay from the University of Torino. She stopped by to talk to us about a new promising regimen that they're investigating at the University of Carfilzomib, Bendamustine, and Dexamethasone. And they've presented here a poster on a phase 1-2 study of this combination with the results looking encouraging. So why don't you tell us a little bit about the study?
Yeah, this is a phase 1-2 trial that was conducted under the EMN umbrella in Italy and in Germany. This study evaluated the efficacy and the safety of combining Carfilzomib plus an old drug, an alkylating agent, Bendamustine. We saw that in a population of patients heavily pretreated, a median number of prior lines that was 4, most of them that had also received transplant, PIs, and immunomodulatory agents. We saw that the rate of PR was around 50% and the rate of VGPR was around 30%, with a median progression-free survival around 11 months. So the results, considering the heavily pretreated population, are quite good. In terms of toxicities, there were mainly hematological, neutropenia, and lymphopenia. And infections. However, infections in this population of heavily pretreated patients is a quite common complication. Based on our data, we recommended to use antibiotic prophylaxis and antiviral prophylaxis, of course, in these patients. Yes.
So we don't really think of Bendamustine as an anti-myeloma drug, but certainly these results can give it credit as possibly. Do you see the utility of Bendamustine more in the myeloma population just as yet another option for patients?
Well, I think that this is an old drug, cheap drug, that can be combined with proteasome inhibitors. It has been combined with bortezomib in the past, now with Kyprolis. So there is probably a synergy. So I think that since our patients at relapse needs always new options, sometimes it is good to reuse the old drugs that we had abandoned and try to reinduce a response.
That's excellent. So, well, we'll look forward to seeing more data coming out on this study as well, as I recognize it's a phase 2. And is the study continuing to enroll patients at this point?
No, the enrollment has been completed. It has been completed, and but there are still patients on treatment.
Follow-up.
Yeah.
So we'll certainly be following that study and seeing how the efficacy continues to evolve with that regimen. So thank you for stopping by and